So I've already evaluated the patient. We've talked about her age, her skincare routine, whether she likes to tan or not. She's definitely been in the sun because I see some sunspots, but what we're gonna do is treat different depths, different energies. I'm gonna start with your cheek area where you're the most fullest at 4 millimeters with an energy of 25, and I'm gonna go and repeat a few of those. Then I'm gonna lattice that afterwards at a 2 millimeter depth with a lower energy. So that's the curation we're doing for her malar cheekbone area. So right now I'm holding a little bit of tension on her skin. And how hard you press matters. So I'm pressing firm enough to get full contact with all the needles, but not so firm that I'm gonna try to get the deep fat layers heated. And I actually like to see a little bit of that pinpoint bleeding. That tells me that this is kind of the body's natural PRP right there. So this is kind of response I wanna see. So I did a few passes here right now at the 4 millimeter depth. I'm gonna go right here where she's the fullest. Press a little bit harder, pull and tension the malar tissue, and I just did 2 passes right there. I want this to go in. In the operating room, in this area, what I do is I micro-lipo some of that fat, and then I fat transfer the nasolabial fold. So in this sense, we're tightening and going to where the top of the mountain is and melting some of the fat. So I actually want to be at that depth here with multiple passes. So now I overlapped by about 50%. Sometimes I turn the head, even though it's a square. There's something different about the orientation of the needles when you do that. So I'm happy with that, and then in this area alone, we'll revisit it. I'm gonna do the same thing with the other side. When I come back here, I'm gonna go at a 2 millimeter depth and go at 20. So I'm gonna pull this tissue. When I do that, I can see how, and I know all the fat compartments. I know their names, where they are. I've operated on this area, so I know exactly how hard to press in what area, and exactly what's under here, all the way from skin, all the nerves, the muscles, the arteries, the veins, where they're located, and their names. That helps. So good response so far. I'm gonna pull the tissue up and rotate the head here to go where it's the fullest. I do the same thing in the operating room or in the office when I'm doing fat grafting. So same good tissue response here. You can see that confluence of erythema and heat that's distributed. If we had a heat sensor right now, you would see an even distribution. If you don't reach the proper heat in the tissue, you're not going to get the contraction and stimulation of that collagen. So you get kind of a Cinderella effect tightening in the first 3 days to a few weeks, and then the collagen actually gets stimulated to remodel between 3 and 6 months. So all of a sudden in around 4 or 5 months, you're going to be like, my skin seems a little tighter. Why is that? Oh, wait a minute. I did Morpheus in Dr. Ghavami's office. I'm going to turn this a little bit here. I want to kind of go, and I want to microneedle on either side of her very shallow nasolabial fold, and I'm not pressing so hard right now. 50% overlap. And so I get kind of that contraction on either side of that kind of crevice or valley. We're trying to get the mountain and the valley both heated. I can even arc and make the needles go a little deeper on the mountain and shallower in the valley, and in between the intermediate zone is the actual nasolabial fold or crease. And this is kind of where the artistry of Morpheus happens, because the needles are so strong and so precisely directed that I can heat different zones literally by millimeters. Now this is the area where we're really cheeky, so I'm going to go a little up on energy and let me know if that's uncomfortable. Right here we want to get a lot of contracture. This is where people get their buccal fat pad removed to get this to come in. She's blessed with naturally very nice cheekbones, and that submalar hollow with the malar eminence here, the combination of tightening these two zones together is what's going to give her that lift. So I'm actually going to lift vertically as I would do if I do a facelift. How's that feel? Okay?
Okay.
Overlap 50%. I have to do kind of 2 beeps or 2 passes all at once, overlap, and then change the orientation. So I'm providing a lattice of collagen contracture at the right depth and energy while I'm actually guiding the tissue on the direction that I want it to be tightened to, which is vertical in this zone. You just got a mini facelift.
Thank you.
And so the beauty of the synergy of this with other types of modalities, such as growth factor dense nutrients to the skin, such as nanofat, or one day we can inject exosomes, or even PRP or PRF, is that while this tissue is healing, you're going to be able to hydrate it, stimulate it to regenerate, and get a boost as the micro injury produces the result. Once again, I'm pulling tight. Okay, so I went over some zones here at 1 millimeter deeper with higher energy, and you can see that nice erythematous response that's fairly confluent that we want. So in this area we can go a little thicker too. That tends to be a very thick sebaceous area, the chin. So let me know how this feels. Open your jaw a little bit. There you go. How did that feel? Good? And here, if you zoom in with the camera, I'll show you something. See, when she does that, you can see the mentalis muscles, how they create a cobblestone effect. Those are the areas where the skin is thick and there's sebaceous glands. So this tends to be an oily area of the body, just like the T-zone. You know, when you're a kid, you know, I always broke out on my chin. So we can go a little deeper here is my point. Now I'm gonna lift this up and go right and stretch the tissue and press hard. So you can see it going a little bit deeper just by pressing harder where it's the thickest. I can get a little tissue lift, and that's where you get a little more of that pinpoint bleeding actually, is because I did go deeper. I'm gonna do one right here. Okay, so that's good for the chin for now. So you can see we have basically some zones. The one area I didn't get yet on this side is this area where we did that vertical lifting and tightening to try to get the submalar skin and the malar skin to be synergistically tightened together in a vertical orientation. We're going to do that on this side now, but first I'm going to do that nasal labial fold variation. I'm going to press a little harder on where it's a mountain, less where it's a valley, and intermediate is the fold. So how I just rotated my hand, those are the little nuances where we like to educate our patients on, and I educate my nurses on when they use Morpheus8. So now we're in scale mode, which is essentially the burst technology. In the body, we've had it for years where we go different depths with one hit. So it goes 3, then 2. So we just got 2 different levels of depth at the proper energy distribution since it's happening at the same time. This is ultra safe because the more superficial layer, which in this case is 2 millimeters, is going to be 40% less energy automatically delivered. That's the brilliance of Morpheus. Awesome. Okay, so now we're going to go to town here on your upper lip. Okay?
Let's do it.
¿Tienes dolor? Dígame. Okay. ¿Listas?
Sí.
How's your comfort level so far? You've done well?
It's good. Yes.
Okay. And we've gone up all the different depths, different zones, areas that are sensitive like the upper lip.
Yeah.
Sometimes this area is a little sensitive in the corners of the mouth. And then as I got close to your lower eyelids, so you're doing phenomenal. Okay, now I'm gonna do this side. So these are different depths than I first started. In the scale mode, I like to see this pinpoint bleeding. I'm a surgeon, so it makes me think we're doing something proper. Okay, I'm gonna do one here. She was gonna have a great result. So one of the things I like about both chemical peels, Morpheus8, and using devices when you have surgical acumen and knowledge of the anatomy is I look at this as kind of the finishing touch. Now she doesn't need anything for her face other than this, honestly, because her cheekbones and her bone structure is so good already. But in somebody who didn't have that, after all of this, I would go ahead and do some fat grafting at deep layers directed exactly in the fat compartments that we have knowledge of thanks to lots of research that's been done. In addition, when we finish this off, I look at it almost like an impressionist painter, where the strokes are not necessarily evenly applied, but the overall result when you look from a certain distance is a uniform kind of painting of something. In this sense, I want to see different types of red tones to know that I delivered the heat properly in the right depth in the right area. Okay, so let's see. 361, really nice. So now we're going to do your forehead. So since we can't streichen scale, I'm going to go to 2 millimeter, then 1 millimeter. We'll do the eyes at 1 millimeter. Here we go. Doing okay? And what do you think about me treating your upper ojos, eyelids?
Sí,
That's seguro.
let's do it.
Then you're going to be too joven.
I don't have numbing cream there. But I need it.
Not from what I can tell. No, we'll do a test spot. I'm going to give you the gift of exosomes on top, okay? Did we do numbing cream on your nose?
I did.
Okay. Para diferentes áreas necesito diferente energía y diferente profundo.
Está bien.
I said everything I said in the past hour in one sentence. See, Spanish is so much simpler. I think so, because she had numbing cream on. She's getting a full Monty treatment. Is that hurting or no? Wow, she's like... Okay.
I mean, I feel it, but I'm not
Yeah.
hurting.
Okay, one pass upper lip. Okay, ¿listas?
Sí.
Okay. So we're basically doing 2 different depths in scale mode here. The neck is really good to do it with these superficial depths, and so we're basically getting 2 depths with 1 pass. And that's the beauty of scale mode. And the second depth, which is the more superficial one, automatically is set at 40% less energy. So the tightening you get from this, we can synergize. You're doing okay? Gets a little sensitive here sometimes with some of that nano or micro fat grafting. And we do that awake. You don't have to be asleep. But most people choose to do a little bit of light sedation. So this is a perfect example of knowing what Morpheus8 is good at. We don't want to go too deep here, because if I go and melt any fat between these platysmal bands, I'll skeletonize and make the bands look even more pronounced. So here I'm going 1 to 2 millimeters. I wouldn't go 3 or 4. And we're also going in scale mode, which automatically lowers that energy in the more superficial layer. Good red response. I'm going to do a little tightening here right underneath. Here I want to get tightening. And then come this way. So she has such a nice gonial angle here. A lot of people do filler for this area. So I'm going to go underneath and accentuate it, tighten, and wrap around this. So her mandibular bone and contour is essentially a fulcrum of tightening. So we want this to not move a lot. So I'm going underneath. And you get that nice tightening. So she has a very evenly distributed erythematous response. And now we're going to do a little in your lower eyelid and we are done. Okay. So I want you to look up. See, it helps to be a surgeon because I know exactly how deep your eyelid skin, muscle, and everything is until we get to your eyeball. So even though I'm near your eyeball, I'm actually nowhere near it. Okay, terminado.
I guess I'm not going out tonight.
You might be able to. Tomorrow you can. You can go to brunch. We'll see if the Benev works.